Hi everyone. I want to take this opportunity to talk about fat grafting. And the reason is, I've had several patients come and I do fat grafting with facelift surgery fairly routinely. And one patient came recently and she said that she saw a couple of videos or Instagram posts or something that discuss the fact that fat is ultra successful. It depends on the skill of the surgeon. It's a technique. It's this. It's that. And but the main thrust of it is that in that person's hand, whoever was doing the video, apparently there's some magic miracle that makes the procedure successful. Well, I want to just discuss data. I don't want to do any kind of emotional kind of hyped up marketing. I really want to be authentic and real with information. So, in order to dispel these myths that exist in marketing just to make somebody look sensational, I brought this article here. So, this is what we call a meta analysis paper. Meta analysis essentially means that you take all of the published literature that is peer reviewed, meaning it's been looked at by many different surgeons and researchers, and the findings of that is pooled to come up with master conclusion or the final conclusion. So that's what a meta-analysis is. This paper is from very recent. I think it's 2021 if I'm not mistaken. I think maybe you can see it right there, 2021. Yeah, so it's very recent paper. And what this paper says is that a volume retention after facial fat grafting and relevant factors. So essentially it's trying to understand and pull together the information to show that how much across the world of all the literature that's been published, how much is retained after fat grafting is done. I mean, all the standards are there, right? The volume and the technique and all that is, relatively normalized. And the results here show that 47% of the fat generally is retained, is what this paper shows. 47%. The overall pooled retention rate was 47% with a 95% confidence interval. Without getting too technical, what essentially this paper is saying is that despite sensational marketing claims in serious surgeons, serious hands, the real truth of fat grafting today is that it's an extremely good procedure. I love doing it. I wish I could do it on everybody starting in their 30s for volume retention, because I believe patients will age well if you start early. Do some small aliquots over the lifetime. And there's a bunch of research going on. And as a matter of fact, we ourselves presented a paper recently at the Florida Society of Plastic Surgery where we're enriching fat and seeing what it does to fat retention. And we had good findings so far, preliminary but good findings. So we're going to build on it. So if anybody tells you otherwise, it's not accurate based on data. It's sensationalization. So I just really want to make sure that the audience that follows me, that values good information, knows data without my opinion involved in it. My opinion is fat grafting, I think, is here to stay. My opinion is that fat grafting needs a lot of refinements further. It needs more technical improvements, more research done, more standardization done, so that we can make sure that the amount of fat we put in is the amount of fat that survives. And we only put what's needed, just like a filler does, not overfill it or underfill it or whatever. That's what we should get to. And that's what I think everybody should hopefully do, because it's the natural filler, it's your own substance, it's the best filler out there for faces or for the rest of the body. But I don't want to mislead people. The truth is, and everybody should know this, today's age, in most hands that are experienced and authentic, about 50% approximately is the amount of fat that is retained. But if you do it more than once, which is nothing stopping anybody from doing it, if you do that, then maybe over 2 or 3 procedures like fat grafting, doing small aliquots, if you retain 50%, the next time you retain 50%, you're actually net adding volume long term. Hopefully forever, right? Because fat, if it's living, it's living. So that's probably the better way to go about this. But rest assured, the standardization of the cannula size, the atraumatic way to remove it, enriching it, putting it back safely, or not overfilling it, all of those things are being done very well in experienced surgeons' hands like mine, because that's what I do a lot of, is facelift surgery, fat grafting techniques with it. So I wanted to share this with you because I think it's important information for the audience to know. Thank you.